Please welcome to the stage the Chief Innovation Sherpa at Reshape Innovation Center in the Netherlands and a member of the SU faculty, Dr. Zayna Khayat.
What a way to come home to Toronto. I've been living in the Netherlands since January, and we have a rule at our Innovation Center that we are not allowed to accept a request to speak at any health event unless patients are a significant part of the program. We couldn't really do that here, although I think there's at least one activated Canadian patient in the room. So you're all going to help me. Get your phones out or your laptops. I need to get you on Twitter. We're going to crowdsource what it is to be a patient. So I want you to think about somebody in your life who's had a significant health event or experience. Maybe it's your mom, your grandfather, your sister, your aunt, your child. Maybe it's you. Maybe it's past. Maybe it's happening right now. Okay? Close your eyes, think about it. Think about what happened in that experience. When did you find out something was wrong? How did the treatments or whatever happened match what you were willing to handle and understand and made sense for you and your family's life? How did it work out? Do you feel like all of science was brought to bear to restore or help manage the health? So I want to know what's in your head. So let's get to this hashtag. And all you got to do is tag it and tell me who it was, mom, brother, sister, and what was the condition. So I was on Twitter this morning, lo and behold, shameless plug for Exponential Medicine in November in San Diego, the best conference in the world after this one. And so I would have said my grandma died of a sudden heart attack. She was dead as soon as it happened. Changed my whole life. So let's start to see what's coming up for you. Dad had a heart attack and MS. Grandma, diabetes, Alzheimer's, Lyme disease. What else? So I want you to hold on to this example because you're going to be my use case of patients through the whole setup of this and, frankly, the rest of this session on health. So first on this word health. Maybe let's go back to the slides if we can. So there's this word health. There's health care, and then there's medicine. So if you think of someone's entire health span, from being generally quite healthy through to something being wrong, going through diagnosis and treatment, and then their body kind of starting to deteriorate at end of life, health is the whole thing. Health is how you feel. Health is how you're able to manage and cope in the face of a physical or mental challenge. Health care is just how the system organizes services when things might be off. And then medicine is a science. Medicine is just that place where we use largely technologies of drugs and medical technology to help with diagnosis and treatment, right? So we're talking about the future of health today because that's where the future is going, not just medicine. So as we've heard today, all institutions, when we built the health institutions we have in healthcare, we were constrained by time, distance, space, knowledge, information, and so it kind of had these features. It was reactive, one size fits all, quite crude, and very, very centralized, like most institutions. And now there's these forces on this institution. So the first, our ability, society's ability to continue to pay for the demand of health services are completely out of whack. Scarcity is a really good time to innovate. But that's not enough. We've known we don't have the resources to absorb the demand by delivering care in this old model. We've known it for 25 years. That wasn't enough to actually tip the curve. Next, a revolution, a consumer awakening. You, this person you all thought of, has access in their phone to all the information that people who were trained for 15 years had access to in their brain. This democratization of the tools and the knowledge is really causing this uprising. And Eric Topol wrote it in his book, Patient Will See You Now. I added this book that just came out today by Dr. Victor Montori at Mayo Clinic, all about characterizing this patient revolution. So patients are activated, we're out of money, but we couldn't do anything about it without the technology to do something about it. And that's where exponential medicine and singularity comes in. So just on this technology, we're going to do a helicopter ride through 2,500 years of medicine, right? From Hippocrates back in 500 BC. These are major milestones of achievement of science that really moved things forward. Every one of these was analog. We got to 1950, post-World War II is when most Western worlds developed healthcare systems, right? It was because employers needed a benefit to get people to stay working with them. And we did the same in Canada. More happened. 1984, Trudeau was our prime minister. Canada put in the Canada Health Act to make it law that hospital care and doctor care was required. That's sick care. So that's been driving our medicine. The human genome in 2001, which we heard about and you'll hear more, all of this was analog. And then 2007, 2008, 10 years after the rest of the world digitized, digitization has finally come to healthcare. And that's why we're doing what we're doing today. So, we heard today in the next 10 years the world will change more than the last 100 or 1,000. Nobody actually said that about medicine until now, right? Because we're now in this digital era, and so that's why Vivek Wadhwa can get away with saying things like this, because it's actually true. So this paradigm upon which everything we know about healthcare was built is now up for that big shift, what Thomas Kuhn would talk about as a scientific revolution, which at the end of the day is creative destruction finally coming to medicine. So what are those shifts? What's it going to look like? So I'm just going to give you a taste for what healthcare is going towards across the whole spectrum of health. So the first big shift is this timing of when services are placed. So like I said, we designed healthcare to react, to wait for something to go wrong, and then fix. That's kind of what we call not healthcare, but sick care. And the future is not only being a bit more proactive, or even preventative, but now predictive. So if you think about it, we know fully that these are the big reasons why people get sick. If I took a barometer of this room of why you are or are not healthy, your zip code trumps your DNA code, right? Your literacy, your environmental exposure, which leads to your behaviors around sleep and diet and exercise and alcohol and smoking. That little blue sliver at the top is actually the consequence of the quality of the healthcare system. Yet if you look at where we spend our budgets for healthcare, so in Canada, $200 billion, about $8 trillion globally, 90% of it is on that blue part, right? It's on the sick care. So imagine if you were running a company and you were trying to get productivity from your employees, and you knew that what made them productive were all these things, and you put 90% of your resources on only one band. Finally, though, the whole organization of healthcare is able to shift to a much earlier. So in your example that you tweeted, if this was kind of the trajectory of the health, they were healthy, something kind of went wrong, it got really bad, we put in a treatment. Public health, vaccinations, sidewalks, sanitation is supposed to catch things a lot earlier so it doesn't get bad, but a lot gets through. Medicine comes in when things are kind of at the peak and tries to intervene and fix it. But we're sitting on a mountain of data and signals and information that we can mine and catch, and that's where predictalytics comes in way, way earlier to catch stuff well before it's ever gotten to the point of no return. And that's the promise of this shift. We think of biomarkers, so everyone's had blood work, so we look at things in your body like your lipids and your calcium and images of your body. Well, voice, the sound of your voice, the speed of your voice, the tone of your voice, has so much data now as a biomarker that will eliminate a lot of these kind of physical modalities. So big, big movement, and we just ran a webinar on this week. So Peter this morning talked about new business models, and this is what gets me excited. Because we have these technologies, we can now consider new business models for how to buy prevention. Omada Health is a great digital therapeutics company in the US that can now put their money where their mouth is. They have just a pretty basic behavioral change program for people who are overweight and at risk of diabetes, et cetera, where they'll get paid the more weight that the people who participate lose. Right? They can put their money where their mouth is. So completely new pay-for-performance type business models. So that was the first shift. Think about your patient. What would it have been like if we could have caught the signals 2, 3, 5 years earlier than when the event happened? The next shift is how accurately we can tailor the services for that person's situation. So again, when things were pretty blunt, we had a one-size-fits-all, which really means a one-size-fits-nobody model of delivering services, and now we can be highly personalized, configurable, tailored, et cetera. So how many of us have signed up for the 5K race, and what size t-shirt does everybody get, right? Which means nobody's needs are met when you give what works for the average. And so the ability to shift from a segment of one to an N of one in healthcare, of all things, is what's kind of coming. So imagine if this population in the middle was all of you. You all had the same diagnosis for the same disease based on your physical symptoms, but we know whether it's a drug we want to give you or a behavioral therapeutic intervention like you're going to see from Alex or whatever it is, that it's only going to work for a very small number. And others, it might work, but it might be extremely toxic. Others, it just won't work, period, and be toxic. This is the ability now to really stratify down to the N of one, not just based on your biology and genetics, and Ray will talk about that today, but based on your values, your situation, your literacy, the language you speak, your tech savviness, you name it, we can stratify and not be so N of one. And so that gets to another business model shift. Peter talked this morning about these CAR T technologies where you could trick your immune system to killing the cancer cells. What he didn't mention is that it costs $475,000 for the therapy. Well, our health systems are financially constrained. Although this will save a life, it doesn't save everybody's life. It doesn't work on everybody. So Novartis is now putting their money where their mouth is, and it can charge and only get paid for the patients in which this technology works. That is a new business model revolution in healthcare. So that was tailoring. Third shift, precision. As much as there's been so much science and innovation in healthcare, it's still pretty crude. We designed healthcare based on what we knew at the time, which was body parts and diseases as we define them. And the classification of diseases has not changed in 50 or 100 years. And it was analog, right? There was no digitization until a few years ago. So we believed things like this, right, for years. You know, some of you have heard me talk about my dad has slits all down his back because the cure of the time when a kid was sick was to slit their blood and let the blood get out and let the body build those cells back in. So we've had this crudeness for quite a while. It's so crude that we now know, whether that's in Canada, the US, or anywhere, that fully 30% of what we do in healthcare is wasteful, unnecessary, duplicative, and even harmful. And this is the Institute of Medicine data of the US $3 trillion healthcare system. So just to put it in perspective, I'm living in the Netherlands. We're a population of 16 million. The amount that the US is literally shouldn't be using in healthcare is the entire GDP of the country in which I live, right? Imagine if you ran a business that was running at 30% inefficiency. You wouldn't be in business. So my favorite quote from Exponential Medicine last year was from Peter's company, from Human Longevity, which really wraps it up. This intelligence shift is medicine going from being a medical and clinical science supported by data to really being a data science-driven practice supported by the humans who are our health professionals. So to give you one example, we all know somebody who's had breast cancer. And a good chunk of the time, those women have to have a lumpectomy, the breast removed if it's a certain size. Well, we're so crude in how we look at this tumor. It's based on an image. So the surgeon will go in, resect the tumor to make sure they get it all. They go a little bit more outside the tumor. Sometimes they just lop the whole breast off to be safe. And 25% of the time, they miss that margin, the edge of the tumor, and they either have to go in and do it again, or it comes back and it's now spread, right? There's now technologies like this one that when the surgeon takes out the tumor, very quickly they run this pen based on the sugars that the tumor cells metabolize, which are different from the sugars that normal cells metabolize. They can know if there's tumor still at the margin, go in and take a little bit more, sew the woman up, and take that 25% down. This is the kind of precision that's coming in all aspects of all of medicine. Another example. We fully expect, and I think we're there now, something like 80% of the population will now live with one or more chronic illnesses. Right? Society wasn't designed to live with a disease. You either died or you got better when we designed medicine. If you take out the 8 hours a day you're supposed to sleep, that means you've got about 5,800 hours a year to manage this illness. So you know your body and your disease more than anybody else. The formal medical system is your 2 or 3 appointments a year to deal with the illness. It's like 15 hours of the 5,800, right? So that's why people say patients are the most untapped, renewable resource of the healthcare system, and we literally haven't tapped this resource. We're still trying to buy healthcare using the formal, big kind of government dollars. But with these kind of tools at our disposal that used to only be relegated to high capital institutions and highly trained people, we can get not only a clear glimpse of what's going on with our body in a democratized way, but continuously, 24/7, not waiting for little bits of information in between the appointment. So that's where Dr. Eric Topol, who's a cardiologist at Scripps and really the biggest thinker on this future of health and what this consumerism will do, will make statements like this about the power of the network of problem solvers to help you figure out what's going on in your body. Okay? So that's the third shift. Last shift, which is the most important one, is around power. So we heard today about all these power shifts across so many sectors of society, and it's finally happened in healthcare. So because it's so complicated and so capital intensive and needed training, we had to centralize things, and very paternalistic. These highly paid, highly trained professionals would tell you what to do, and you had to be a passive recipient of that information. And it's just going the opposite way. Not just decentralization of the modalities of getting the services, like every other industry, but the democratization of decision making. So we've built our system on these analog tools: bricks, people, paper and pens, and the fax machine. We're the only industry keeping the fax machine industry alive. And pick a D, it's happening, right? Dephysicalized, dematerialized, disintegrated, and ultimately we'll get to a word where healthcare is digital. It's seamless interplay. When you need to be physical, you're physical. Otherwise, it's digital. So I've been waiting for CB Insights. So who's seen CB Insights? They published the unbundling of the auto industry, of the bank, of travel. Finally, they did their first healthcare one. So that's when I feel like I'm not just blowing smoke here. This is actually happening to our industry. All these little startups chipping away at pieces of the business model of these traditional incumbents, like a large hospital. And then you'll see the World Economic Forum publish in their kind of 2030 reports earlier this year, goodbye hospital, hello homespital. And my boss, Lu Shen, who's also faculty here at Singularity, would say hello phonespital, as care will be everywhere. So that's one big shift of decentralization. What about this democratization shift? So the American Medical Association really sets the code for how doctors are to train, practice, and behave. The medical curriculum has not changed very much in like 100 years. And so it was founded on codes like this that says, you know, patients should not be questioning what their highly trained doctor tells them to do, right? They should not let their opinions interfere. So that's the foundation of healthcare, because all the knowledge was with these highly trained people. But now we're moving to this shift from kind of 1.0, where all the information and the services flowed to the patient to passively receive. We're kind of in the middle of 2.0 because we're generating a bit of data. Sometimes our provider will let us give it to them and care about what's going on in our life outside of the visit. But soon it'll be a distributed network, and your formal health provider will just be one node in this kind of data lake. And that's where my boss predicts in the not too near future, your health professional will ask to subscribe to your health data instead of you begging, for a copy of your X-ray or whatever it is. So this, folks, is the future of health. So that's the so what. So now for the now what. What does it mean for you? So think about it in two ways, right? This amount of change for a sector that's kind of completely built antibodies to change is a lot to take. And so if you look at the tension, we live in a world where these types of pretty groundbreaking technologies transform society. The pace at which they're scaling, and 50 million users was a general barometer. If you add Candy Crush and the others, I can't even make a bar chart on this. We fully know in medicine, though, from the time that something is published and known to have impact, either better outcomes for patients or same outcome but way lower cost, 17 years, right? Think of when anesthesiology came out, antiseptics for hand washing, when we found out that, ulcers aren't caused by eating salty food, 17 years to become mainstream. We've got a big conflict of the pace of change and the capacity to absorb. So what can you do about it? So first, let's go back to your patient, okay? Think about them. Think about what would have been different if we had the healthcare system that's coming, that's personalized, that's predictive, that's decentralized, where they have power. What would have been different? Throw it up on the Twitter. What would have been different? Would your grandma be alive? Would your child not have schizophrenia? Would your sister not have asthma? So I did it this morning. Another shameless plug. This was in my Twitter feed this morning. Go Canada. And I honestly think for me, my grandma wouldn't have died. If we knew what we know now and could do what we did, and if we had more power, that would have gone away. What would have happened with your patient? Let's take a look. So even just saying having access to your own information is huge for a patient, right? There's so much data around that. That's all we want to know. It's our body, it's our data. We'll go back to the slides. So what I ask you to do is I implore you, when you have an experience in the health system, you, your family, whoever, demand more. Even if you have to tell them you went to this freaky conference at the Brickworks and you learned some stuff and Zayna said to, right? So it'll go something like this. So this is my 19th century health system sending me an email asking me to fax them a copy of whatever, my specialist referral. Or when you want your X-ray and they tell you to give them $50 and they'll give you 6 CDs for your image, or they just say no. And I'd say, no, I can't because of where I live. Is it because I live in the Netherlands? No. So they're like, well, where do you live? In the 21st century, goddammit. So Peter asked, what's our moonshot? And some people wrote some awesome stuff on Twitter. I'm like, this is my moonshot. We're going to have a bonfire of all the fax machines. We're going to do what Australia did with their guns, and everybody has to turn them in, and we're going to do something. That's my dream, okay? So join me. So that's kind of the first. Now the second, now what for you is as a business leader. And I was with Coral Enterprises last night. We have oil and gas here, and real estate, and banks, and some healthcare. Who would have thought that any of these companies on this page are now healthcare companies? Right? I get so excited about the new entrants coming in because they understand consumers, they understand data, they understand meeting you where your value's at. And so we've all seen this version of this slide, right? Airbnb is the biggest accommodations company, they don't own hotels. Uber doesn't own any cars. Facebook doesn't own any content. And so, when's healthcare going to be on this slide? And who's it going to be? Some think it's going to be Facebook. Amazon yesterday, I don't know if you saw, on speculation that they might get into retail pharmacy, markets moved for CVS and Walgreens and all of them. Is it going to be you? Can you bring Canada into the new health economy by bringing what you do in whatever industry you're in to fix these problems and help us get to the shift? And I hope it will be, because you're all depending on it. Thank you.